And we're back on this Saturday morning Sports Medicine Weekly. Hope you're happy and healthy. And time now for our Ask the Doctor segment, giving our listeners the opportunity to have Dr. Cole address their specific sports injury issues. Very easy to submit a question. Just go to our website, sportsmedicineweekly.com. On the homepage, you will find a link underneath the photo of Dr. Cole and yours truly on the right side of that homepage. Just click on that link and you can submit your question. And we're back with Dr. Brian Cole. I'm Steve Kashul. First question for you, Dr. Cole, from one of our listeners. Do you have any tips for wearing a mask while running outside?
So, Steve, it's a great question. Clearly, we're going to be expected, at least in Illinois, wearing a mask when outside, and it's one form of distancing, if you will, and it would allow me, for example, if I unknowingly were positive from potentiating the disease to someone else. So if we're all wearing it, arguably it's the right thing to do. But it is a challenge when you wear one when it's running. It makes it harder to breathe, and it can be a struggle. So I would tell you there are some tips and pearls out there. When you could wear a buff, a scarf. You want it to cover your mouth and your nose. You got to really focus on having an even breath. It's important to remain calm. Sometimes people get that feeling of almost a panic attack or claustrophobia. So slow, even breaths, and again, not wearing necessarily. You don't need an N95 mask, which makes it very difficult to breathe. But wearing a buff or a circular scarf can make a big difference. And also maybe contemplating slower and short. I think that those are some of the things that people can do. Running is important because it helps to maintain your cardiovascular fitness, but doing this also limits exposure and some breathing strain that we have. So shorter, slower runs can make a difference, and wearing a mask that doesn't feel like it's sort of strangling you, but does accomplish the goal, and make sure you wash it afterwards, can all make a difference. But we all have to be kind of accustomed to living in this way for the time being to protect ourselves and to protect one another.
Very good. Dr. Cole, a final question of the show comes from one of our listeners. Dr. Cole, my son was doing some squats in our own home gym and thinks he may have severely suffered a knee injury. What does he do? Go to the emergency room, or can he make an appointment with you now?
So, Steve, that's a great practical question because people are struggling with what to do if they have traditional medical problems. Goes as far as heart disease and other things. I mean, you still have to get care and not ignore these particular problems. So, indeed, we are open. So, from our perspective, if you went to our website at rushortho.com, you would see that we have these processes in place. So, patients call; they can be screened almost instantly by a telemedicine evaluation to assess the acuteness of the injury. Sometimes it's just a conversation. I would say going to the emergency room is not necessary for most things that certainly have an onset like this. And then if need be, that patient or that individual, your son, could come in and get an X-ray, MRI, what's in a physical exam in a very safe way. People are screened at the entrance. Their temperatures are taken. Everyone is asked to wear a mask. We know about how to keep our environment clean. We're spacing our seating apart even while wearing a mask. And we have a hands-off registration process that, frankly, when you think about how we kept H-flu out of the equation, these are really the same basic things. And what we've learned in the healthcare setting is that if you do these things, even healthcare workers who commonly work with known COVID-positive patients, they can stay disease-free taking all these measures into consideration. So in this instance, this patient, this individual can get it evaluated. I would say good not to go to the emergency room for something like this, and it can be evaluated initially through telemedicine very quickly, same day, and then if need be seen in the office that very same week. So all systems are go. We just are doing things a little bit differently, but delivering the same kind of care.
Dr. Cole, we're out of time. Have a wonderful rest of the weekend. My best to all you, your family, your staff, and your patients. Talking to you again next week.
Be well.
Many thanks to our producer, Shane Reardon. Our coordinating producer is Tracy Torrell. Also want to thank David Cole for managing our website and our business operations, as well as Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Kashul saying so long. Thanks for listening to Sports Medicine Weekly. We'll be back again next Saturday, 8 a.m. Central, with a brand new edition of Sports Medicine Weekly, only on
670 The Score.